Breast cancer vlog, day 64. 3 weeks post double mastectomy. One of the things that they warn you about is you're going to have good days and bad days. It's going to be lots of ups and downs. And let me tell you, that is the story of my recovery. And I had a pretty big setback yesterday. I ended up back in the emergency room. So I had 2 nights ago woken up at 2 in the morning, and my incision was very painful. And so I got up, took a little bit of pain meds, went back to bed, woke up at 6:30, and I was shaking like a leaf. Like, oh, I always know when that happens, that like I'm sick, like there's something really not good happening. And over a period of about 20 minutes, it just got worse and worse and worse and worse. And so made the decision to go to the emergency room. And guess what we found? My incision underneath my right armpit had broken open, was weeping. Infection. I have a post-op infection about this long underneath my right armpit. So, and my potassium was a little bit low, so that might have accounted for a little bit of my shaking. So they gave me IV antibiotics and then sent me on my way. And unfortunately, I did the same antibiotic by mouth last night, clindamycin, and it burned the hell out of my esophagus. And because I have gastroparesis and I have sensitivity down there, that is not the medication for me. And so I have sent in a request asking that they switch it to a different antibiotic. I'm waiting to hear back now. Ironically, everybody's on vacation this week. My primary care is on vacation. Like if I look at my surgical contact list, they're all out, but the one nurse that coordinates a breast cancer program. So I'm hoping that she will answer me. I am hoping and praying that she will. So I wasn't prepared for the intensity of this recovery. I wasn't prepared for how difficult it would be to have such big incisions. I wasn't prepared for how tender they would be. And it's taken a toll. I mean, I'm a strong woman. I've always been a strong woman. But I want to feel better. I don't want to feel confident in my body. And right now I don't. I just don't. Especially after being back in the emergency room yesterday for several hours. So, I mean, I feel a lot better today. I'm not shaking today. I've got a good course of antibiotics in me right now. It's going to be a long road. I had said that I would be out of the office 4 to 6 weeks, and then I thought, oh, maybe I'll be back in 2 weeks. Yeah, no. No. I can do a little bit of work here and there, but I'm still at just 3 weeks post-surgery in the gritty work of healing these incisions. So, you know, they're just very, very tender. Sometimes they want compression and sometimes they don't want anything touching them. And right now they don't want anything touching them. So getting comfortable is hard. It's just very, very hard. So, if I would say anything to somebody who's going to be facing a mastectomy or double mastectomy, number one, I don't regret my decision. I think it was absolutely the right thing to do. I'm very, very grateful that my lymph nodes were clear and that my surgical margins were clear. But just like when I had my hysterectomy 7-8 years ago, you have to respect the fact that that our bodies are healing, and healing is going to take time. And you have to be patient, and you have to let it heal. You just have to let it heal. Now, I will say the other thing that I'm kind of struggling with is like what the heck else is going to happen? You know, so I had pre-cancer, pre-uterine cancer. I mean, that's why I had the hysterectomy. I had the cells, the complex endometrial hyperplasia with atypia, and, quote, a vague architectural complex, which means it was just starting to grow a tumor when I had my hysterectomy. And now I've had confirmed breast cancer. Like, what else? Please, God. Nothing else. It just feels very, very unfair. But anyway, that's my life today. I hope that you're having a better summer than I am. And for those of you who have put off your mammograms, please don't do that. Go get your mammograms early. Early. Don't wait, because the earlier it is, if you do have cancer, the smaller it is, the easier it's able to be treated. I don't have to have chemotherapy or radiation because mine was early. There was a lot of it, but it was early. So tell your family members, tell the women in your family, get your mammograms, get that checked. All right, guys, that's my story. I'll see you on the other side.